I am Dr. Elisa Sackin. I am a physical therapist and co-owner of Rise Pediatric Intensive Therapy.
Hi, I'm Nicole Reedy, Occupational Therapist and co-founder at Rise Pediatric Intensive Therapy.
Backward about Rise Pediatric Intensive.
At Rise Pediatric Intensive Therapy, we provide PT and OT services for children with disabilities and neurological differences.
What is the vibration therapy technique?
Whole body vibration is a therapy technique that provides gentle micro vibrations to the whole body. It has a lot of benefits for muscle mass, bone density, balance, coordination. So it's a really amazing modality that we use with a lot of our patients.
How do you incorporate vibration therapy in the sessions?
At Rise, one of the main ways we use whole body vibration is at the beginning of our sessions to warm up their bodies. So it's a nice way for children to get some added proprioceptive input, to relax their muscles, to loosen up their joints before starting with more intense exercise. And also children really love it. So it's a fun way to get them comfortable and used to being in clinic and with the therapist before they start their exercises.
Does using vibration therapy at the beginning help children feel more comfortable or confident during the session?
So once we started using the Lifepro vibration plate at the beginning of our session, we really found that children had improved body awareness. So they were much more confident and ready to participate. They felt more safe and in their bodies and ready to engage in those exercises that we were asking of them.
Do you see any difference in how the session goes since you started using vibration therapy?
So sometimes during our sessions, if kids are getting a little bit dysregulated, they'll actually walk over to the vibration plate and we give them a little vibration break. And it can kind of help calm them and regroup them so then they're ready to participate in things that are maybe not their favorite or less preferred. So I would say it's used as a warm-up, but also as a regulatory tool to help our kids.
And then those kids who love using the vibration plate, we try to incorporate it into different exercises too. So if we see that it calms them down for the full session and they're very nervous with certain exercises, we'll try to use the vibration plate more. So we'll think of different ways that we can use it, have them sit on it and stand on it, walk all throughout the session if it's one of their favorite things to use.
Intensive vibration therapy techniques.
An intensive model of therapy is a way of providing therapy services in a short, condensed time with increased intensity. So we see our patients twice a day, 5 days a week, anywhere from 1 to 3 weeks.
What happens after the therapy?
At the end of every intensive, we always give parents a home exercise program so they can carry over all of the skills that their child learned with us into home. One of the main things that we suggest and parents buy every single time is the Lifepro vibration plate.
Why is the Lifepro vibration plate part of this after therapy plan?
The reason we always suggest the Lifepro vibration plate is most importantly because it is much more economical than the other pediatric vibration plates on the market. It is also smaller. It comes in a variety of sizes, but for most of our kids, they're in smaller spaces. It's much easier for parents to store a mini vibration plate that the size that Lifepro offers. Lifepro also is much more, it's stronger and it's medical grade wavelengths compared to some of the other vibration plates on the market, and they have a lifetime guarantee. So if anything happens to the vibration plate, they can certainly get a replacement and they last a very long time. So we love recommending Lifepro vibration plates.
How long have you been recommending Lifepro's vibration plates?
So we started using Lifepro probably about 1.5 years ago, and we really noticed a significant difference between a brand that we had previously. We felt like this was much better quality. So since then, whenever families come in and their child uses it, they immediately ask us, where can we buy this? We want one for home. So we've been recommending them now for about 1.5 years, I would say.
Do you know if the parents and kids are doing the therapy homework you assigned to them?
We actually just got a text yesterday from one of our families. They started using their Lifepro home vibration plate at home, and they started their home program. And mom texted us that their daughter was able to sit on the front porch independently for her school pictures. And she really felt like it was because of the new vibration plate regimen that she started.
Recommendation by instructors.
We recommend the Lifepro vibration plate because of their FSA and HSA eligibility. They have a lifetime warranty, and it's much more affordable than many other plates on the market.
How does vibration therapy support children with autism? And does it help the muscular structures?
So if a parent has a child who is autistic and they are looking for sensory equipment to have in the home, I would definitely recommend them looking into getting the Lifepro vibration plate. The Lifepro vibration plate offers lots of different sensory experiences. So with these vibrations, it activates the proprioceptive system, the vestibular system, the tactile system, and you can do lots of different activities with your child that has sensory differences. So whether your child is autistic or maybe has sensory processing disorder and presents as sensory seeking, it can be a regulating tool for home. They can stand on it, sit on it, lay on it, and it can help their body feel more organized and allow them to engage in activities more successfully.
Children with neuromuscular disorders impacting their tone, muscle spasticity, muscle tightness, and strength often require specialized therapy, usually PT and OT. And the way we're able to carry over all of the results they get from therapists is by a home exercise program.
Products recommended for parents with autism children for therapy.
So after one of our patients is finished working with us in their intensive, we often recommend a home exercise program to the parents to carry over at home. This includes different exercises, positioning, and oftentimes we use the Lifepro vibration plate to do a lot of these exercises to help with stretching, to keep them loose, and continue improving on that strength. After they're finished with their intensive with us, we give them a list of activities and exercises to do at home.
Top products by Lifepro recommended.
As part of their home exercise program, we often recommend the mini massage ball, the Lifepro wedges for stretching, the mini waver, and the massage gun.
So Lifepro has several products that are really awesome for sensory seekers who are looking for that sensory input at home and looking for maybe a way to regulate after school. So whether that's standing on the vibration plate while watching a show, whether that's holding the mini vibrating ball, using it almost as a fidget, to even using the massage gun to help kind of wake up their muscles after a long day of sitting at school. So after a long day at school, oftentimes kids come home with a lot of energy, and just hopping on the vibration plate for 5 to 10 minutes can really help their body settled and get them ready to do homework or help with after school chores. So it's a really great regulatory tool.
Neuromuscular conditions. Impact.
We see kids who have sensory differences. So it could be minor sensory differences or major sensory differences, like hearing loss. They are seeking sensory input in other areas because of that deficit. So for those children, they're always seeking vibration. They're always seeking that extra input. So that's why we love using vibration plate for them. Sometimes they don't understand where their body is in space. They have trouble standing up. They're nervous about it unless they can feel that vibration on their feet, because it shows them where their body is in space. And they're like, okay, now I understand. Now I can stand up better and with more confidence.
And even when we have kids that aren't necessarily sensory seeking, but perhaps their threshold for sensory input is quite high, but they aren't actively understanding how to get it, and they come in feeling super nervous and just have no body map or understanding of where their body is in space, using this vibration in different ways with multiple different products, we've seen a huge improvement in participation in therapy because, again, they can understand where their feet are in relation to their head and the rest of their body, and they feel a lot more confident.
Appropriate posture of kids on the vibration plate.
When they're standing on the vibration plate, not only does it help with balance, but it also helps with strengthening because those postural muscles need to activate in order to stand up against gravity.
It also stimulates the intrinsic muscles on the bottom of their feet. So it really wakes up those muscles. Their ankles have to be really stable. So it stimulates more proprioceptive input, muscle strength, all through the whole body, right? Because it goes from your feet all the way up the chain.
Another really cool fact, I guess you can say, that we've seen in our own sessions with our patients is that kids that have communication differences and delays, they always say movement moves language. So when you're on a vibration plate, your body is moving, your vestibular system is being activated, and we've often seen kids say more words or make more sounds when they've been on the vibration plate. And we've also heard feedback from parents, actually, that they've just exploded with their communication.
Your diaphragm is a muscle, and when we stimulate that muscle while sitting on the vibration plate, it helps them get their sound out. And they like it. They think it's funny to make those funny sounds while they're sitting on the shaky plate. And so it's a nice way to stimulate some sounds, but also in a fun, engaging way that kids love.
Recommendation for an appropriate standing position for the home program.
So we recommend the child to sit or stand in the middle of the vibration plate so they get both kind of wavelengths. And it really depends on the child. If they're younger and maybe a little bit more hesitant, we'll start with lower vibration in just a couple minutes. If the child's a little bit older and has higher muscle tone, sometimes we'll increase the intensity. With stretching, we usually go a little bit lower with the intensity, and then for muscle strengthening, we usually go a little bit higher, but usually we keep it to around 5 to 10 minutes.
And we really can base the intensity off of the child's tolerance too, right? So you're not going to go wrong using it in one way versus the other. As long as you stay in the middle, like we said, you get the vertical and horizontal wavelengths. You're going to still see benefits whether you do one kind of program versus another.
Children's restrictions while using the vibration plate.
We don't have any age restrictions when we put a child on the vibration plate, but we do have safety restrictions. We want to make sure if a child has a seizure disorder, it is cleared by their neurologist before they are allowed to go on a whole body vibration plate. Our very young children that we see, under a year old, they need to have full head control to be able to be on the vibration plate, and oftentimes a therapist will sit on the vibration plate with the child.
How should a child start a vibration therapy program?
Whenever you're starting a child on a waiver plate, you always want to adapt to their weight, their age, their tolerance, and also seek medical approval depending on their diagnosis.
Conclusion: personal recommendations of Lifepro products.
Because we are PT and OT team and we do intensive therapy, it is very hard on our bodies. We do consider it a privilege to use our bodies to help the children that need our help, but it is tough. So we love using the massage gun and the vibrating foam roller and the handheld massage ball to get out knots, to take care of our bodies in order to help these children thrive.